This is Shelley Craft coming to you live on SNNLive. We're at the Marcum MicroCap Conference 2014 here in New York City. I have with me Ken Waggoner of Nuvilex, NVLX. It's a publicly traded company. Ken, welcome to SNNLive.
Thank you. Thanks for having me.
It's good to have you. Let's get an overview on Nuvilex for our audience.
Well, Nuvilex is a biotech company that has a platform technology. It's a delivery system we refer to as cell-in-the-box. It's a live cell encapsulation technology that we'll use to treat solid tumors, in particular pancreatic cancer tumors and diabetes.
Well, you're naming the top diseases in the world. So tell me how it works, please.
Well, the live cell encapsulation process is one where cells that have been cultured to do something, in this case change a prodrug, which is a bioinert or chemical agents that are injected into a person's body, will change into a bioinert system into a cancer-killing form. How that happens is it comes in contact with cells that have been cultured that express an enzyme that normally convert a prodrug in the liver system into its cancer-killing form. That doesn't occur in our situation. What we do is we take these capsules that have cells that have been specifically designed to overexpress a particular enzyme that will change that prodrug from its inert system into a cancer-killing form. And what we do is we place these capsules in pancreatic cancer right at the base of the pancreas. We have targeted chemotherapy. We get a great deal more concentration of the chemotherapy agent right at the source of the problem. And that enables us to use less chemotherapy agent in the body, which results in no side effects from this treatment, and to get much, much better results in terms of median survival and 1-year survival rate.
Okay, this is important stuff. What is the technology behind the cell?
It is a cellulose-based capsule that is designed in a specific way. It's patented technology designed by a company that now owns the technology called SG Austria. It's designed in a way that enables these capsules to be placed into the body to produce the kind of biological reaction that occurs in the system when it comes into contact with the bloodstream carrying a lower dose chemotherapy agent, in this case something we call a phosphamide. It's an old chemotherapy agent that's been around for a long, long time. And it turns that agent into something that is incredibly effective at dealing with tumors in the abdomen, in this case pancreatic cancer.
Which is... It's a death sentence when it's...
Unfortunately, it is. Right now, it's the fourth leading, most lethal cancer. It's predicted to be by 20,000 and 2020, the second leading cause of death from cancers.
How big is the market? I mean, it has to be enormous.
Well, pancreatic cancer isn't as large a market as you might think. There are about 38,000 people in the United States that get pancreatic cancer. Almost 90% of those people don't make it past the first year. What the bigger market has to do with solid-state tumors generally. What's unique about this encapsulation technology that we have is that you can use these capsules to encapsulate any kind of cell line and have enormous results, positive results on cancers, solid tumor cancers generally. For instance, there's a sister drug in the same cell line. We use a phosphamide right now to deal with pancreatic cancer. It's called cytophosphamide. That chemical agent is exactly the same as a phosphamide with a couple of slight changes. Is one of the 10 combination therapies that's currently used for breast cancer. We can actually encapsulate cytophosphamide, put them in these capsules, implant them at the site of the various tumors in a woman's breast, and have incredible results. We know that because of what's occurred in our preclinical studies when not we, but our predecessor company actually did these studies in mice, and rather rats, and the results were incredible.
So I want to ask you, how soon to market?
Well, it depends on what we're trying to market. Right now, we're on a fast track for pancreatic cancer. We're set to start our preclinical studies with respect to things associated with pancreatic cancer. In this case, symptoms. We're going to be dealing with pain and ascites. That's the fluid buildup that comes with solid-state tumors, fluid buildup in the abdomen. We'll start preclinical trials in a matter of weeks. we'll have our preclinical studies, and then we'll have our clinical trials underway in the beginning of the first quarter of next year. Depending upon the results of those preclinical studies and then the beginning results on the clinical trials, we believe we'll get on a fast track, both here in the United States and where we'll be having our phase 2B clinical trials, and that's in Australia.
Okay. For more information, let's get your website out there.
It's just Nuvilex.com. That's all you have to put in.
Okay, so we'll spell Nuvilex.
Nuvilex. Our trading symbol is NVLX.
He stole my clothes. It's Nuvilex. Ken Waggoner. I'm Shelley Kraft. This is SNNLive. Nuvilex symbol, by the way, is NVLX. I want to make sure you know the symbol. We're at the Marcum MicroCap Conference 2014 in New York City. Ken, thanks for coming.
Thanks so much, Shelley.